Hello and welcome to this week's episode of Giant's Healthy Innovators Live TV. My name is Barry Shrier and I'm your host. I'd like to thank the many tens of thousands of viewers who dial in to watch these weekly TV episodes. What we're doing is we're bringing together some of the leading innovators and investors and people that are at the forefront of healthcare, technology, and innovation. We're looking at some of the greatest challenges in society and healthcare, and we're exploring how, with technology innovation, we can address some of these challenges. Our vision is to improve the health and the well-being of people around the world by facilitating innovation in healthcare and supporting health tech entrepreneurs. So thank you everybody for watching this week's episode. Once again, my name is Barry Shrier and I'm your host. I'd like to thank our sponsors as well. I'd like to thank Vodafone Business and Barclays Bank, and of course the Giant Health event for supporting these episodes. Giant would like to make an announcement that this year, for the first time, we have European Health Tech Innovation Week, which is 5 one-day conferences taking place in May. That's from the 17th of May to the 21st across 5 cities. These conferences are sponsored by 24 Haymarket. So thank you to 24 Haymarket for your generous support. And we're very glad to have you guys involved in these. So European Health Tech Innovation Week is looking at some of the leading innovation and some of the best innovators and presentations from investors from all across Europe. The 5 conferences are taking place in Barcelona, Liverpool, Berlin, Paris, and Stockholm. And we invite you to go to the Giant website, www.giant.health, to learn more about that. And we would love to hear from everybody watching these episodes to learn more about how to get involved. So Rick, it's nice to see you. Thank you so much for joining us.
Thank you for having me.
And hello, Paul. Thank you for joining us. How are you?
Good afternoon, Barry. Great to be here.
Good. Thank you very much. So look, Rick, we want to talk about some of the biggest issues in healthcare and what are some of the biggest challenges in society and what's happening in technology and innovation, which is important, and what's new. So Rick, any suggestions? We'd love to hear your views on these things.
Well, I mean, I think there's a lot of things that are going on. Typically, I'm based in the U.S. And we obviously have a very different healthcare system than most of the world, actually, particularly Europe. And I think the pandemic certainly has highlighted some of the issues, and actually, quite honestly, some of the solutions I think that are available out there. So, I mean, one of the things that we struggle with, and I think it's worldwide, but in particular in the United States, is the cost of healthcare. That's controlling costs is always an issue, and our payer system, which is not a single payer. When we're talking to the various managed care organizations, they're always looking for cost savings. And as you indicated, we concentrate mainly on the digital therapeutics, digital health side of things, which is a really exciting time right now. So the pandemic is really somewhat, as tragic as this has been worldwide, and it's been just awful. The sector of digital health, digital therapeutics actually has benefited from it, just because the world has been able to see the application and see the efficiency and the cost savings that's available.
Yes.
So,
that's a very good point, Rick, and thank you for raising that subject. We know, of course, and everybody will agree, that the pandemic has been a terrible crisis and a very sad situation for many people around the world. And yet, at the same time, that is a theme which is coming up again and again, which is that with digital technologies, we do have the opportunity to provide more or better healthcare at lower cost. And the cost issue you mentioned, Rick, of course, is fundamental. My understanding is that the demand for healthcare services is going up everywhere. And I can't believe any country anywhere in the world where the demand for more healthcare services will actually ever go down. And yet you can't have unlimited supply with unlimited cost, can you? And so these are big issues. And likewise, Paul, what are some of your thoughts on big issues and challenges in healthcare today and technology?
Yeah, well, I mean, I think just to echo Rick's points, I mean, we're obviously in the UK, but the dynamics, it's a different healthcare system, but the dynamics are exactly the same. Heading into COVID, you had a significant shortfall in the supply of healthcare relative to the demand for healthcare services, and that's just been really exacerbated over the last 12 months as sort of ward capacity was sort of pushed towards dealing with the pandemic and away from elective surgery, what we call the elective surgery backlog here in the UK. So you have a dynamic where that backlog is just mounting and building and building, and it's going to take several months just to clear it before we even get back to a normal condition. And so the only way that the healthcare system here right now can kind of deal with that is really either by looking to the private sector, and you're seeing a lot more collaboration between the sort of public and private healthcare systems here in the UK than you ever have before, or indeed, as Rick points out, kind of embracing some of these digital solutions, whether it's on the administrative side or indeed, in some of the more clinical, facing areas that I think prior to the pandemic, there was just an aura of caution around. And, I think clinicians and administrators alike have been actually forced to embrace those technologies. And I don't think there is any going back in a post-pandemic world.
I would agree with that. And they providers have been kind of forced into it. As far as would take things like remote patient monitoring and telehealth, things of that nature. And I think from our perspective and the providers we've talked to, they've actually embraced it quite a bit. They really have gravitated to it and have found it very beneficial. So it's really kind of accelerated. Like, okay, and I fully agree, we're not going back. All right, so we may slide back a little bit, but this remote healthcare, things of that nature, it's here to stay, and it's going to grow.
Yes. Yeah. So in fact, I suppose you can say there's a little bit of a silver lining to the pandemic, which is that there's been a willingness within the healthcare system to accept innovation and to adopt to new innovation. Of course, we've had the opportunity to have things like telemedicine for, 15 or 20 years. Necessarily, the healthcare industry is quite a conservative sector, isn't it?
Yes, it is. Slow to move.
Cautious to adopt new technology, but now that we're here and we have these challenges and we are adopting technologies and things like telemedicine and remote monitoring, I think that can only be good. Paul, from the perspective of remote monitoring, is that an area that you guys are involved in?
Yeah, we've been invested in remote monitoring actually heading into the pandemic, and really sort of around a couple of applications. Again, very focused on sort of the chronic disease side of things, because that's where I think remote monitoring has its largest application, in particular. Diabetes, both type 1 but also sort of type 2 preventative, diabetes, and sort of more recently. Actually, right before the pandemic set in, we invested in a business that facilitates both remote diagnosis and monitoring of a broad range of respiratory diseases, which, as you may imagine, has seen a good uptake during the pandemic. So I think remote monitoring, or I think from our perspective, pre-pandemic there was remote diagnostics, there was remote monitoring. I think now it's all one and the same thing. There's remote disease management, and I think it's just a really powerful tool in the clinician's toolkit now, and it's here to stay.
Yeah, absolutely.
We see a lot of that as well. It's interesting you mentioned respiratory. I have a client that's in the respiratory area. So it is. There's a remote spirometry aspect of it, but it's a full platform. And we do a lot of work with, as I mentioned before, a lot of payer organizations here in the United States. And that's where things seem to be moving. There's a lot of interest in, as opposed to like a standalone, remote monitoring, it's disease, how can we manage the disease better remotely? So, a platform like this, they've got, obviously the spirometry and things of that nature, but there's other things that they can monitor, and they get a better, like a 360 view of the patient. And then over time, they're going to evolve in, and this is what they're looking for in the payer side. Like there's a lot of comorbid situations. So a lot of the patients that have COPD, for instance, or asthma, they've got diabetes, they've got cardiovascular aspects of it. So the platform that can manage all that is evolving and becoming very attractive.
Yes.
Yeah.
Rick, this idea of what do you want to call it? Broader platforms where they are not just saying, "Hello, I have a new widget which I have designed and it does a better narrowly defined job than previous widgets. What challenges does that create for the innovator? If there is this, from my understanding, extremely complicated ecosystem of electronic patient records that are not compatible everywhere you look, and lots of gadgets, and we're all wearing these little gadgets, and lots more gadgets coming onto the market, and every drugstore and chemist has more home healthcare monitoring gadgets for sale. I mean, I think I understand the principle, but how does that work? How do you say, look, all of this needs to be consolidated. Hello, healthcare provider, take my platform, which is doing all the consolidation for you.
Yeah, it's very fragmented right now. I mean, you're absolutely correct. So there's a lot of kind of standalone monitoring devices, or even therapeutic devices, so the innovation is there, but that's going to be one of the challenges moving forward. Is how do we integrate all this? Most of them at this point don't integrate well into electronic health records.
Yes.
So what eventually will probably happen is, and we're starting to see this in our integrated delivery networks here. The integrated delivery networks, they have the hospitals, they also have a payer component, so the insurance aspect of it, and then many times they'll also own the labs, and the physicians in the community are employees. But they're starting to develop their own platform. So then the individual ones can plug into it, and then they can they can monitor the data across. So I think we're not there yet, but I think that's where things will eventually end up. That even if it's a standalone, they'll probably plug into a platform or several platforms that will start emerging.
Yeah. Oh, that's very interesting. And Paul, tell us a little bit more, please, about your business, and what kind of things are you guys doing these days?
Yeah, well, actually, I mean, it's funny, this sort of conversation around the fragmentation of EHR, because it's actually one of our most recent investments about a year ago.
Cool.
A company in this administrative layer of the business called Doctor, which is a business that starts out effectively sort of facilitating the digital patient booking and appointment management system, and kind of goes all the way through to post-operative follow-up, and kind of just taking patients outside of a hospital setting. And one of the interesting things about that business, obviously, it kind of plugs in with many of the EHR providers within the UK.
Yes.
In the acute care setting, within the NHS trust, and there's about 250 NHS trust, but it's exactly the same dynamic over here. You've got a few hospitals research led are taking on the Epic systems and the big American systems, but really most can't afford it, and you've got kind of this very fragmented. A lot of the hospitals are kind of using different systems, and it's one of the biggest kind of barriers over here to the adoption of or broader scale adoption of kind of digital technologies. You see a lot of small scale players, but nobody breaks through because of this dynamic of having to work around the EHRs. And one of the fascinating things I think that we're certainly seeing is that there's a lot of discussion going on right now, between very senior industry people and the NHS about consolidating the provider ecosystem, starting to kind of move towards more standardized technology frameworks and technology architectures.
Yes.
With few of these players, obviously, industry really wants it. The big pharma and the biotech guys, really want sort of more standardized EHR, records and systems for obvious reasons. But there's always, as I'm sure there is in the US, you have to kind of break through the political sort of side of things as well, which is going on. But if anything can kind of push the system here towards a more standardized framework, it's probably the last 12 months and all the events we've gone through.
Yeah, no, it's definitely it's a huge issue. And here in the United States, the two large hospital EHR systems, it's Epic and it's Cerner. But they don't support the community that much. So there's all these smaller ones that don't talk to each other. But it's a big issue, and our clients are typically the small innovative companies that are coming up with digital therapeutic, digital health, and that's an issue that we talk about is eventually we got to get to the point where we can integrate into electronic health records, because what these digital applications have to fit into physician workflow. That's the issue. They live in their their EHR. Their electronic health records. So for them to have to, kind of get out of that, go to a separate portal, that's one of the impediments of adoption. Is does it fit physician workflow?
Yes.
And there are companies that actually can. They're starting to emerge that we can kind of contract with them and they'll integrate into the electronic health records. But that's an area that we definitely need to conquer to get this more widespread.
Yeah. No, that makes a lot of sense. Rick, with regard to it seems to be endless challenges of interoperability with electronic patient records, EHR. I can obviously see that if you are Epic or if you are Cerner, you don't want interoperability. If I understand correctly, that seems to be a pretty obvious basic ambition of any company, is to be as monopolistic as they possibly can. But therefore, who can take the lead in driving an interoperability agenda? Is that the actual providers?
That's a great. I wish I had the answer to that. There's been initiatives in the United States with our 21st Century Care Act and things of that nature that was trying to incentivize physicians to adopt EHR, but the interoperability just has lagged behind. And it might be organizations like HIMSS that start trying to move this forward.
Sure.
But it's eventually, it's a problem because it's all private, so, the government can only take it so far in the United States as far as trying to make these things all work together. But I will say, I mentioned it before, the integrated delivery networks and things are starting to move a little bit more that way in the United States. That'll help a lot because there's challenges with it as well because they start owning, the physician offices and things of that nature. But, when it is an integrated system, most of them are private at this point. Those systems become, integrated with the data, and then you can manage population health a whole lot better.
Yes. Yeah, absolutely. So, Paul, what are examples of other technologies you guys are looking at? We're talking about, I suppose, almost a ecosystem challenge, which is interoperability, but we have new technologies coming up, don't we? And what are some of the things you guys are looking at?
Yeah, so I think from our side, we've touched on a few of them. Obviously, I just mentioned the work we're doing around sort of the infrastructure around EHR providers. We're doing a lot around remote disease management, particularly areas such as diabetes, respiratory, coronary, those sort of three major areas where I think digital health solutions are going to be cornerstone of managing those diseases going forward. And I think as Rick pointed out, there's just a lot of comorbidities between those three areas and other chronic diseases more generally. So I think the data coming out of that is very interesting. And I think there's obviously kind of challenges with different approaches or business models, whether it's sensor technologies, and certainly I think in the UK we have a very strong ecosystem around hardware and sensors, and particularly things like diabetes management. Thinking next generation of continuous glucose monitors and kind of moving away from very costly, very invasive ways of tracking diseases. I think we're also sort of starting to just look at digital plays around cell and gene therapy, and that obviously is a very interesting area. And then I think for us, I think we looking at what's gone on over the last 12 months also sort of see quite a lot of scope for investing and interesting opportunities around drug manufacturing, because I think that's sort of part of the value chain, looking at the pharmaceutical side of it that probably has received less investments than the beginning of the value chain, the target discovery and new candidate discovery. So we're spending quite a bit of time on that part of the value chain as well.
That's extremely interesting. And I suppose with the pandemic and the pressure on vaccine production, there's probably an awful lot of am I right? An awful lot of the manufacturing ecosystem, which hasn't necessarily got that much attention in the past.
Well, I think one of the interesting things, and this is probably less true in the US, but I think drug companies everywhere and governments everywhere have been looking at the last 12 months and saying, well, okay, look, having your manufacturing and your supply chains sort of sitting locally and something like this is kind of an area of strategic, importance. And
yes.
I think there's a lot of discussion, I think, going on right now, within UK leaders to sort of say, okay, look, we need to invest in our manufacturing capacity,
Sure.
or reshore some of that, coming out of COVID. So I think there'll be quite a lot of that going on in addition to just basic investment behind pandemic preparedness. And the next time this comes along, and there probably will be a next time, the frequency of these pandemics are getting more and more frequent. And Western governments, whether it's the UK or the US, I don't think anybody can fiscally afford to bail the economy out again. So I think there's going to be more and more investment behind that to get ahead of the next one of these things.
Absolutely. Rick, from your perspective regarding digital therapeutics, so often people think of DTx as, for example, a standalone, what do you want to call it, service or product. But there's more to it than that, isn't there? And it's a little more, how do you say it, engaged with the traditional pharma and drug manufacturing and distribution sector. Is that right?
Yeah, I mean, it definitely is, and there's a couple of different business models that have happened here. So, some of the companies like Pear Therapeutics, which has just a smartphone app for substance use disorder and opioid use treatment. They pretty much are trying to do it on their own, and develop their own distribution, et cetera. But it's not a physical distribution; it's software. It's an app that goes phone. And then other companies, a lot of it is because of resources. So a lot of these companies are small companies, and they'll partner with a pharmaceutical company. So pharmaceutical, large and small pharma is starting to really take a look at the digital sector. Most of the pharmaceutical companies are thinking, because they're at their core, they want to sell drug. I mean, that's what they do. They've done it for hundreds of years.
Yes.
And their main goal is to sell drug, and it's to acquire patients or to retain patients are the two big drivers. So a lot of them have been looking at digital therapeutics more of a companion to their drug, and not so much a standalone. They're not really selling it yet. I think they will. But a company like Happify, they're starting to partner with. They have an application for depression and anxiety, and in some of these companies that are pharmaceutical companies like Novartis are in chronic disease. Well, comorbidity of chronic disease is many times depression. So therefore, a company like Happify can develop a specific application for a specific disease state, and that's kind of how pharma is starting to get into it. But obviously they have sales forces. They have a lot of resources that small companies don't have. So we're seeing a mix. We're seeing some companies trying to go alone with some great technology. We have clients that they have applications for panic attack and PTSD. One of my clients has a digital therapeutic. It's actually a hybrid for migraine treatment, completely drug-free.
Wow.
Yeah. A ADHD, there's a gamification. Achille Labs is one of my clients, and they have an application for treatment of ADHD in children. They're kind of going alone in that regard. So it'll be interesting.
That's a big challenge.
A lot of different business opportunities and business models.
Sure. Yeah, no, that's extremely interesting to hear. Thank you for providing some of those examples. A lot of these are direct to consumer. Is that correct?
Well, that's another way to go. So some of them go direct to consumer. Some are FDA approved, some are not.
Okay.
But and I'll go back to Happify. So Happify started as a direct to consumer application, and what they've kind of evolved into is now starting to partner with pharma, and then pharma will help them develop FDA approved prescription only type of applications. So it's kind of interesting to watch, because I've got a long history in the pharmaceutical industry too, on the commercial side. Typically a pharmaceutical company spends 10 years and multi-$100 million to develop the drug. They put it out there, and then as the life cycle comes and other competitors come in, patents expire, and then they go OTC. Some of the digital therapeutics are doing it just the opposite. They're starting OTC, if you direct to consumer, and then they're migrating into more of an FDA approved digital, prescription only application. So that's one way to do it. But others are going directly to the payer organizations, and it's going to be prescription only and more of a traditional pharmaceutical approach.
Yeah. In the grand tradition of the entire industry, maintaining extremely complicated structures.
Well, it's interesting you say that, Rick, because I think one of the challenges, obviously from an investor point of view, in particular when you look at application of AI to some of these areas, and when looking at the respiratory space, the company we're invested in going after that, and it's a very interesting one. I mean, there's always this kind of interdependency or chicken and egg scenario of regulatory approval and the training data that you need to kind of get these things going, and obviously kind of skirting the commercial model, as you suggested, kind of going OTC and getting the training data up and running. So by the time you kind of come to FDA or CE marking, whatever the case may be, you actually have a good, robust history of the stuff working and having a clinical result.
Yep, and actually the real world evidence that's generated many times is extremely valuable. So, again, kind of regulatory bodies and also payers, they want to see randomized controlled trials for sure. But they've also come to the realization, and we're starting to see it, unfortunately, with some of the vaccines, that many times when you get it out in the real world, you get a little bit different results. So it's a blending between, having a randomized controlled trial evidence, scientifically controlled, but also that real world evidence is extremely valuable to payers and regulatory as well. So when they start kind of DTC and it's more of a consumer, they can generate all that data, which is extremely helpful.
Absolutely. Paul, are you guys looking at any direct to consumer propositions, or are you focusing more on the traditional, if you will, B2B environment for these providers?
Well, it's interesting because our view is evolving. I mean, we prefer to invest traditional kind of B2B, but as we've just discussed, I mean, sometimes you just get to the place where you just that companies can't monetize immediately in that space without regulatory approval. So you're pushed into saying, okay, look, let's take the view we're going to go with the consumer grade application. It might not be where you see the value ultimately resting, but if it's a novel application, and the company is coming out with a novel approach to that problem, you can see a path to kind of getting over that hump. So I think investors like ourselves are being pushed to be more imaginative in that sense, and kind of bringing some of these technologies to market.
Yes. Yeah, well, very interesting and good to hear. I mean, of course, as you know, here at Giant Health, we're a community. We've been going for 7 years, serving the international healthcare innovation community by way of the events we do, of course, these TV shows. We've been looking at the DTx sector, obviously, which is evolving and expanding and gaining, if you will, not more credibility, but more awareness. And our view is that there's still a challenge within the larger businesses, global pharma companies and global medtech hardware businesses, regarding understanding what's going on at the coalface, so to speak. So we're looking at helping big pharma companies and big medtech hardware businesses by way of getting challenges from them, getting, if you will, details from them, briefs from them, so to speak, about some of their own challenges, and then working on creating like a business incubator accelerator model where we're collecting DTx innovators to serve directly the specific challenge of a pharma company, or the specific call, so to speak, the creative challenge of the pharma company. And so are you guys aware of anything like that? I mean, there's obviously a lot of incubators out there, a lot of accelerators, but I don't know what's going on in the world of DTx directly. Is that something that you guys are involved in at all, Rick, for example?
Yeah, some of there are some incubators that are coming out specifically for digital therapeutics. We see it in two areas. So we do work with large pharma on some of their digital therapeutics.
Nice.
There's been some partnerships, and we help them with their commercialization strategies. Some of the big pharma companies actually have their own kind of venture arm, and they'll have some kind of an incubator. We're also seeing it on the large payer side.
Oh, okay.
Yeah, so Humana, Anthem here in the United States, and some others actually have incubators specific for digital.
Nice.
We try to get our clients in front of these organizations to hopefully get funding and get the support they need. So we are seeing it.
Yeah. No, very interesting. How about you, Paul? Is that an area you guys are involved in, or not really?
Yeah, well, I mean, obviously, I think as Rick says on the pharma side, I think they've been doing a lot of thinking about how they can work with digital innovation. I mean, I think Rick mentioned earlier the notion of kind of companion diagnostics and companion digital health solutions. I think one of the interesting things we're seeing now, and you kind of mentioned the medical device side of things, is that space is a lot more nascent and early in terms of thinking around digital technologies. And kind of when you think about the big medical device players, the Danaher's and the Thermo Fishers, just how many pieces of kit they have out there, right in the world, and their connectivity into what's going on within the research lab environments. There's some pretty interesting kind of solutions. So I would say that the kind of idea of sort of doing more around incubation and support, there's probably a lot of that going on at the pharma level already, but I'd certainly say within the sort of medical device community, there's a lot of scope there to bring them into the digital age in the same way the pharma companies have moved in.
Absolutely.
Yeah, they seem to be, the medical device companies seem to be lagging, but we have had conversations with Medtronic and Boston Scientific and things like that. So they're starting to think. But they are, in my opinion, a little bit further behind than where pharma is. But they're kind of, again, the pandemic. I mean, I think there's so much interest that's been generated. They're like, we can leverage this data and these applications as well.
Exactly.
Yeah. I think there's a huge amount of opportunity in that segment.
Sure. Yep. Hey, well, look, you guys, I wish we could sit around and talk for another hour at least. And I wish I could buy you a round of drinks and we could continue this conversation, which is extremely interesting, but we don't have too much time left. So we'll just go around and have a little bit of a summary right now. Rick, for example, is there anything that your organization is doing that you'd like to announce, or do you have any papers coming up, or any partners or products that you're launching? Anything you want to tell our audience about?
Not really. We're not really launching anything new, but we just continue to expand our client base. We're happy to work with small startups on their commercialization strategies. I said we're starting to work with larger pharma companies.
Nice.
We have expertise in market access and reimbursement. So it's just such an exciting area.
Absolutely.
I mean, it's amazing. As I said, I have a long background in pharmaceuticals, and I started getting involved 2.5 years ago when I started this business. And it's just so exciting.
Yes.
All the technology, from virtual reality to remote patient monitoring, you name it, it's endless.
Absolutely. Well, good. We'd love to keep in touch with you, Rick, obviously. And I hope that through the Giant Health community, maybe we can connect you with a lot of businesses that would be able to make use of your valuable services.
We'd love to talk to them.
Good
We'd love
stuff.
to help, quite honestly.
And likewise, Paul, we'd love a summary. What are you guys up to? What are your plans for this year? Any announcements, any new deals to announce, or what can we do to support you and the Giant community and bring you all together?
Yeah, well, I mean, we focus on a couple of verticals, but I'd say digital healthcare right now for us, alongside supply chain and logistics,
Yeah.
Digitization is kind of there are two areas that we're really focused on.
Yes.
We've just actually made an investment a couple of weeks ago, a Series A round investment in a cell and gene therapy based business.
Yeah.
And the reason I mentioned the medical device digitization is that we're hopefully going to announce one in that space
Yes.
in a couple of weeks' time. Which I do think is kind of a good area to be going into. So we're looking for
absolutely
these segments that are kind of the next wave of digital adoption within the healthcare space. So I think if you watch the space, we should have 2 or 3 good announcements within this vertical coming out by the time your conference comes around, Barry, in a couple of weeks' time.
Yes, well, that's extremely good news. What are typical deal sizes for you guys?
Well, we're as an institution, we focus on seed and Series A tickets. So we're tending to look to put £1 to £3 million up to sort of $5 million to work in any transaction. So the 2 deals that we're talking about, the one was a $15 million ish round that we participated in. We didn't lead. We'd led an earlier round, and then the other company, we're prospectively leading a seed round of $3 or $4 million, by the end of it. So that's really where we're playing. And I think the other thing I'd point out, obviously I'm sitting in London, Rick's in the East Coast, is that we're also sort of seeing a lot of convergence between sort of what we're doing in the UK and what's going on in the US. Obviously the healthcare systems are different, but there's a lot of the technologies that kind of commercially and clinically will resonate across the ocean. So I think a lot of companies, when they're successful here, are very keen to kind of get into the US market, given the size. Obviously it's a much more competitive market than what we're playing in over here, but from a healthcare point of view, it's just a much more significant market. So I think all of our guys are looking at getting into the US market if they're not there already.
Yes. Yeah, excellent. Well, now send them to Rick.
We see the same thing. They're very successful in Europe, and then obviously the US is such a big market, it makes sense. But it's very complex, so we can help them figure it out.
Indeed.
Yeah, well, great to connect offline, Rick.
Likewise.
Excellent. Hey, look, I'm so sorry that we don't have more time to continue this extremely interesting conversation. But Rick, thank you very much. It's a great pleasure to have you on this week's episode of Giants Healthy Innovators TV. Thank you.
You're quite welcome. I appreciate
it. And likewise, Paul, thank you very much. And of course, we're extremely grateful for your financial support as a sponsor of Giants Healthy Innovators TV and a sponsor of Giants European Health Tech Innovation Week. So thank you very much for that. Very keen to continue building up our partnership with you and your team. So thanks again for that. So once again, my name is Barry Shrier. I've been your host today. And on behalf of our sponsors, 24 Haymarket, very, very proud to bring you this week's episode. Thank you to Rick and thank you to Paul. We'd also like to remind everybody, once again, we have coming up from the 17th to the 21st of May, we have European Health Tech Innovation Week, which is 5 one-day conferences taking place in Liverpool, Paris, Barcelona, Berlin, and Stockholm. These are one-day conferences and trade shows looking at a lot of the latest innovation in digital therapeutics and other areas in European healthcare technology, showcasing a lot of entrepreneurs. We've got a lot of investors coming together, and some of the largest hospital groups will be participating. And so we look forward to everybody coming to that and participating and joining us. The website for that is www.giant.health. So please go ahead and learn more about it there. Once again, I'm Barry Shrier from Giant Health. Thank you very much. And we hope you've enjoyed this week's episode of Healthy Innovators Live TV. Thank you.